Carpal tunnel syndrome is a common condition that affects people who perform repetitive hand movements, such as those that work on computers, assembly lines, or in construction. It occurs when the median nerve, which runs through a narrow passageway in the wrist called the carpal tunnel, becomes compressed. This compression can cause pain, numbness, tingling, and weakness in the hand and wrist. But we're going to talk about this for a second because we think about the pain or the compression happening in that area of the wrist. But with carpal tunnel syndrome, it's not just the wrist. Usually we have some compression in the wrist. We can have some compression in the elbow. We can have some compression in the shoulder. We can have some compression in the neck. And if we have compression in any of those places, that can cause or make worse the carpal tunnel syndrome we have. So we have to make sure that we look at all that. Now, if you think you need surgery, there are other options. There are natural things that can help alleviate symptoms and improve overall hand and wrist health. So here in this video, we're going to explore some of these alternatives and provide instructions on how to use them safely and effectively. First, we're going to talk about some hand exercises. They can help improve blood flow and reduce inflammation in the wrist and hands. Some examples of hand exercises include wrist rotations. Rotate your wrists clockwise and counterclockwise for 10 to 15 seconds or 10 to 15 repetitions each way. Next is finger bends. This finger bends and gliding. Gently bend your fingers towards your palm and hold for a few seconds and then repeat 10 to 15 times in each hand. Next, stretch your hand by spreading your fingers out as far as possible and holding for a few seconds. Repeat that 10 to 15 times. Besides exercises, we can do things like using wrist braces that can keep the wrist in a neutral position and reduce pressure on the median nerve. There are lots of types of wrist braces, including sprint braces and compression braces. It's important to choose a brace that fits comfortably and provides adequate support without restricting too much movement. Next, acupuncture. Acupuncture involves the insertion of thin needles into specific points on the body to stimulate healing. It has been shown to be effective in reducing pain and improving function in people with carpal tunnel syndrome, but it's important to seek treatment from a licensed acupuncturist who has experience in treating carpal tunnel syndrome. We send all of our people to Nicole Razor, an acupuncturist in Oro Valley. She does a great job in taking care of people with pain and especially carpal tunnel syndrome. Nutritional support. There are certain dietary changes and supplements that can help reduce inflammation and promote overall hand and wrist health. An anti-inflammatory diet, which includes foods like fruits, vegetables, whole grains, lean proteins, can help reduce inflammation in the body. Also, supplements like turmeric and fish oil have been shown to have anti-inflammatory properties that will help you to relieve pain. It's important to follow recommended dosages for these supplements and to speak with a healthcare professional before starting any new supplement, because especially turmeric and fish oil can have some blood thinning effects. Chiropractic care and cold laser therapy. Let's talk about that. Chiropractic care and cold laser therapy can be effective treatments for carpal tunnel syndrome. Chiropractic will involve the adjustment of the spine and other joints to improve mobility and reduce pain. It opens up the nerve pathways so that the nerves can communicate well, so that the body functions well. Cold laser and low-level laser therapy can reduce inflammation. So when you put those together, it can reduce pain and improve function with carpal tunnel syndrome. Our office, Tompkins Family Chiropractic, takes care of people with carpal tunnel syndrome all day. And we provide personalized treatment plans to help alleviate those symptoms and improve overall hand and wrist health. So to schedule an appointment, go to our website, call the office, schedule an appointment at tompkinschiropractic.com/schedule, and we'll be happy to help you. So here we go. Hand exercises, wrist braces, acupuncture, dietary and nutritional changes, supplement support, chiropractic care, and cold laser therapy, all effective treatments for carpal tunnel syndrome. If you're experiencing persistent symptoms, seek help today. We'll be happy to help you. Have a good day.